26, 2021 meeting of the Burlington Board of Health to order. My name is Dave McSweeney. I'm the vice chair, and I am chairing the meeting today for the existing chairman, Dr. Weiner, may have to leave. So we will start out the meeting. Libby will read the Pledge of Allegiance for the entire audience.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, under God, indivisible, with liberty and justice for all. Thank you, Mr. Chair.
Thank you. Libby, I appreciate that. So we have today joining us, we have Chairman Ed Weiner. We have board members Dr. Wayne Saltzman, Mary Beth Welch, Libby Wollenjevitz, in addition to the staff of Susan Luminello, Dawn Cathcart as recording secretary, Christine Mathis, and Sarah Quartermash. Did I say Sarah Cathcart? Dawn Cathcart, Sarah Quartermash, apologize. Is the technology specialist here and the secretary, so appreciate that. Next, I'm going to read the like a one-man band here. Read the order for public meeting laws. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the phone at 408-418-9388, meeting number 179-464-1697. Also, we will be monitoring the comments on Facebook Live to see if there are any that we wish to address. And as a reminder to the entire board that all votes are required to be done for all virtual meetings. Okay, with that, just give me a second. Next up, there are no minutes to approve today. Citizens' time, is there anybody here that's dialed in or on Facebook Live that is not on the agenda and wish to address the board? And Sarah or Dawn, do we have anybody at all?
Nothing on Facebook.
No one that I can see here.
All right, great. So the next, I'll turn it back over to Dr. Weiner for the chairman's report. You're on mute, Ed.
Thank you very much. For those who are watching, Mr. McSweeney is chairing tonight. I have a gravely ill family member, and I'm waiting for a call from Mass General Hospital, and I may have to leave. These times are really extraordinary, and as I and my board and our professional staff have been working extremely hard. The coronavirus and COVID-19 is not going away. We as a board, and I got to say my outstanding staff, has been over the top busy for the last 2 weeks. The last 2 weeks we had 5 vaccination clinics. We have provided vaccine to 200 first responders and medical personnel. We've handled so many pandemic questions and complaints, many meetings with elected and appointed officials. I'll point out that I speak to the school committee very, very regularly, the chairman of the school committee very regularly. We've had many teleconferences with the Massachusetts Department of Public Health, a spirited presentation with Ways and Means Committee to justify our professional position that we were happy to receive approval from the from the town meeting last night, and I want to thank Ways and Means for all their assistance and all their help and all their guidance. They really are a wonderful group of individuals, very committed to this town. We've had lots of phone calls to answer around the associate public health proposal. And lastly, last evening, we had a town meeting presentation, and I want to thank town meeting for a 75 to 24 vote in favor of a new position for the Board of Health. We are very grateful to everybody who is in elected and appointed public office. We are grateful to everybody who works for this town, and I am grateful for a wonderful Board of Health and Board of Health staff. Thank you.
Thanks, Dr. Weiner. And I actually, as acting chair, I'm going to have liberty in expanding that to personally thank you for all your efforts in getting that position approved. We started this, well, you've certainly been talking about it for years, but we started the actual efforts last year, and you really have been a great advocate. You literally have talked tirelessly to folks, who anybody that would listen to get, or those that wouldn't listen to get their support. And you really ushered the process along, more dedicated than I ever seen any other board member in any other board do. So it would not have happened if it wasn't for you. And I appreciate all your efforts. It was a long process and tireless process that you went through. I also want to additionally thank actually all the boards that we've been in front of and talked to, in the board members that publicly supported the position. We know that we're in an economic downturn, so getting this approved was not easy, and it was not easy to get folks to support the position, and we couldn't have done it with all those folks. And I echo your comments on Ways and Means. Great group of people, and they were very supportive. In the overarching town meeting, even those folks that the 24 folks that didn't vote for it, it was really quite interesting and exciting to watch local government in action and to see the process unfold. It was a work and a great work, and a great body the town meeting is, and obviously I'm glad that it got supported and voted through. But it was just an overwhelming support for the Board of Health. And again, I want to thank you personally. So thank you.
Mr. Chairman, during the citizens' time, or chairman, right after or right now, we were hoping, and I did speak to our Director of Public Health, who was going to give us a quick review of the vaccine situation, specifically because there are people who are watching and waiting for that. So if I would like to request, Mr. Chair, if you would recognize our Director of Public Health, who can talk about what's going on with the vaccine and how frustrated we are.
Certainly. Susan?
Yes, thank you. So yesterday, Department of Public Health announced that we can begin vaccinating for phase 2 on February 1st and change the phase 2 prioritization a little bit from what it was last week. So currently, the phase 2 prioritization, the first group is age 75 and over. Then after that, it is age 65 and over and people with 2 comorbidities. And then it goes into more a broader group where it includes school staff, public health officials, sanitation workers, et cetera, that fall into different job functions. And then lastly, it will go into the additional job functions after that. So we thought we were going to be getting more vaccine than we did. So yesterday, every week, we put in a request. We're an approved site. So we put in a request with DPH for vaccine, both our first dose and our second dose of vaccine. So currently, we have completed our phase 1 doses for first responders, and that's 200 doses. And the week after next, we will be beginning our second dose of the phase 1 people that we vaccinated. That is guaranteed, and we will be getting those doses for a second dose. So with the knowledge that we were going to be starting phase 2 next week, I was hoping we were going to get more vaccine. So I did put in for 800 doses because I think that that's how much we can do in one day at the high school. However, Department of Public Health came out with yesterday that they're only going to allow a maximum of 100 doses for everybody at this point, for all local boards of health. So we are going to get 100 doses that we're going to have at a clinic next week. And we've already gotten a lot of phone calls, a lot of interest from people. We have a list of people. We've reached out to the elderly housing, and this is going to be for 75 plus. So I think we're going to fill that up rather quickly, but we're going to continue to get our 100 doses. Probably they told us mid to late February, and then they're going to look at it again. If the state gets in more doses, then they'll increase our allocation, and we'll be able to increase the amount that we give out at our clinics. So that's where we stand right now on the number of doses that we anticipate getting. And I can't really plan for a bigger type of clinic unless I know how many doses we get. So we were told, do not start signing people up for your clinics until you've been approved for the doses. Well, we don't get approved for the doses until, we request them, and then it takes several days after that. So right now I only can plan for the next 2 weeks, and hopefully we'll have more information, and then we can do more planning after that. But it just kind of depends on how much they're going to decide to allocate and where. It's my understanding that there are still people who fall in phase 1 that haven't received their vaccination yet, and that these larger vaccination sites are continuing to vaccinate phase 1 people. So also too, we have partnered with the Council on Aging because we understand that it's going to be a little difficult for some people to sign up online because that's the requirement. You have to sign up to this software called PrepMod, and you have to have an email address, and some people may need help with that. So this Council on Aging has agreed to help us with that, and they will be signing people up for our 75 plus clinics. And any questions on that?
Hi, Mr. Chair.
Yeah, go ahead, Mary Beth.
Susan, is that website link for registration on the Board of Health site already?
So we're not making that link public. We do have the option to do that. So you can request from the state that you put a pin on a map and you make your clinic public. But that means that anybody anywhere is going to be able to sign up for our clinics.
Mhm.
And we
Okay.
want to
Yeah.
have some control over the people, who have already called us looking for the vaccine, and then people in our senior housing and whatnot, so that we're not getting people out of town signing up for them. And also we want to make sure that people meet the criteria that that of the 75 plus. We did do that. We were a pin on the map for the first responder clinic. And once we opened it up to the public, we found that we were getting people that just were not supposed to be signing up. And then we had to make a lot of phone calls and explain to people that it wasn't their time to get the vaccine.
Okay. So if they're in that phase, the residents that are watching this, or they would call the Board of Health and you'd walk through the process with them.
So we would ask that they call the Council on Aging
Okay.
because they're going to be assisting people in signing up.
Okay.
If they call the Board of Health main number, we're going to put information on our main number with the Council on Aging's phone number if they want to find out about getting the vaccine. I will just say that people just need to have some patience where, we need to have patience. It's frustrating for us as well that we can't get as much vaccine out as we'd like to. But we can only work with what we have, and we're going to sign people up as quickly as we can and vaccinate as many people as we can based on what Department of Public Health allots to us.
Thanks for taking the time to give that message out, Susan. I think that will be really helpful for folks that are watching or review it later, and also for us as board members for phone calls that we get. Thanks.
Just another thing that people need to commit to. So, and this is what we'll explain to you on the phone. It's very important if you get the first dose with us, that you get the second dose with us. So if you need to commit to getting the first dose and then getting the second dose 28 days later. So for every first dose clinic that we're holding a second dose clinic 28 days later for the same people. So when somebody calls to sign up, they're actually calling and signing up for two clinics, first dose and second dose. I want to just make that clear because we've had some people in our first responder clinics who signed up for the first dose and then couldn't make the second dose, which makes it difficult for us because we need to kind of have even numbers when we're giving out the vaccine, because once you open a 10-dose vial, you have to use that entire vial. So we will fill in those empty spots, but it kind of just makes it a little bit more difficult logistically for us when that happens.
So Susan, that's actually the question I was going to ask, is about the second dosage. So when we get the 100 doses, are we getting the first and second dose at the same time? Like, what's the chance? And this is my concern. I know I'm probably preaching to the choir here, but what is the chance that we get the 100 doses of the first dose and then we don't end up getting the 100 doses of the second dose 28 days from now, right?
Yeah.
And also, like, I just don't feel like there's really a great statewide strategy around how they're administering this right now. And I know I'm preaching to the choir, like I said, but that would just be an awful thing to happen, that we go through and give everybody the first dose and then the second dose doesn't come in, and then maybe, and I don't know what the process is, but there's got to be a timeline where the first dose needs to be administered again if you don't get the second dose. So I just would be worried about the overarching strategy around this.
So we have been told that we will get second doses for every first dose that we gave out. So we have given out 200 first doses in phase 1. We're told that it's going to automatically be sent to us the next 200 doses when it's time to administer them. So they'll also change that too, in that now we need to request those doses. So for example, this week I requested our 100 doses and then our 100 doses as well. So we were told that that's not going to happen. I hope it doesn't happen. I hope things don't change, because it's really important for people to get the second dose. So, and people need to understand too, when they get the first dose, they're not fully vaccinated with the first dose. So they don't get fully vaccinated until 1 to 2 weeks after the second dose.
Gotcha.
And
is a lot of this information going to be put up on the website? Because I just see a flood of calls coming in.
Yeah, we're working on that, getting the information on the phone line and on the website. We're going to put something on burlington.org. Amy Warfield, I talked to her today. So we just need to write something up. And basically, it's going to be just what I said. If you can call this number, we're vaccinating 75 plus at this time. We will change that message as things change. And if the clinic gets filled up, we will put, our clinics are currently filled up at this time. So we'll put that on our website and have a link from the burlington.org about the most, where we're at with the vaccination.
Mr.
Great.
Chairman,
Yes.
a couple of things.
Dr. Warner,
First,
sure.
I just want to note how frustrated we are. We're dealing with a moving target with the Massachusetts Department of Public Health. We were ready to begin 800 doses a day, and we just can't get the vaccine. I am just so frustrated with this. I have called our state representative, Ken Gordon, multiple times. I speak to him almost daily. He is doing everything he can to push the governor's office, push the Massachusetts Department of Public Health, and do everything he can to expedite the delivery of dosage. So I just want to point out that Ken Gordon does communicate with us regularly, and he's doing the best he possibly can, and he's frustrated also. So I don't know what to say. I have friends all over the country who said there's plenty of vaccine in places like Florida and other states, but I'm not sure what's going on in Massachusetts. And I almost am embarrassed by the situation, as we all are. I know we're all getting calls. I'm getting many calls. So all I can say is thanks all the members of the Board of Health, all of our staff. We're ready. We have a medical reserve corps, 250 people. We're ready to volunteer to get this done. We just don't have the vaccine. And it's not just Burlington, it's everyone in the state.
There was some discussion today on the call about they may be prioritizing certain areas. So the hardest hit areas, with the most COVID cases in the past, may be where they're sending the most doses of vaccine and where they're going to be standing up their own clinics. So they mentioned that on the call today. I don't have any additional information on that. But I imagine that we're going to stay where we're at the 100 doses.
And I'm assuming that this is the same for all the communities. We're not behind, say like Woburn or Wilmington or Bedford, right? I mean, everybody's getting the same.
Yeah, unless they're looking at now implementing that type of plan where they're maybe sending more to those communities that they feel were the
more higher risk, right?
Yeah, more harder hit communities.
Great. Well, thank you. Thanks for the update. I appreciate it. Does any other board member have questions or comments related to this? Thanks, Susan. I really appreciate your efforts around this. Okay, next up is application for approval of a special permit and approval of minor engineering change, 60 Blanchard Road. Christine Mathis, I think this is for you.
Yeah, I'll start by just a quick background in case new people are watching. So the applicant, Azure Clean Rooms on Demand, is looking to utilize an existing building on Blanchard Road in Burlington. They would provide clean room lease spaces for multiple tenants. Those tenants are largely small-scale life science type industry that conduct research and development, laboratory and light manufacturing. So Azure, as the management group, intends to provide chemical inventory control, laboratory, waste management, health and safety, training, site access, and security. As a whole, the facility will be a very small quantity of generating hazardous waste. However, future individual tenants of clean rooms may require individual biological safety permits issued by the Board of Health. And I say may require because our biological safety permits cover 3 specific categories of types of operation, and those include rDNA, risk group 3, chemical use, and select agent use. I did ask Azure to do a survey of their current clean room tenants in Waltham to see which of those tenants would, under our regulations, require an individual biological safety permit from the Board of Health. And they came back and informed me that 5 of those 6 current tenants would require such a permit. So we're anticipating a lot of their future tenants will require these individual permits. So the applicant was at a subcommittee meeting in December 2020. They presented at the last board meeting on January 12th. They're doing the minor engineering change applies to stormwater improvements and including new curbing, catch basins, water quality units, and a stormwater collection swale. There's interior modifications to the building as well as some alterations to the exterior of the building. And just by way of site history, it has been a manufacturing site since 1970s. It does have down gradient property status from the adjacent high voltage engineering / Bellafram MCP site. That site has been under active monitor and remediation for chlorinated volatile compounds in groundwater since the 1990s, I believe. And I did ask their LSP to take a look at the need for vapor barrier or other vapor intrusion mechanism in the existing building. And based on the depth to groundwater contamination, which is largely in bedrock, and the fact that the few shallow monitoring wells that are near the building have had either non-detect or groundwater contaminant levels below the GW2 standard since like over 12, 13 years or longer. His opinion is that that is not required. And I would agree with that opinion. So I have included a brief LSP opinion from him on that in this board book that is new material. I do want to make one editorial note before you ask any questions of me or the applicant, and that is if you currently in the proposed conditions, there are 17 conditions listed. However, the numbering got a little bit goofed up, and condition 7 should end at the phrase future protection of site occupants, period. And then a new number 8 should begin the next paragraph, which says the Board of Health requires the applicant to submit a well management plan. So that will change the total number of conditions to 18. And I will make that editorial note before finalizing our recommendations on the special permit and MEC to the planning board.
Great, thanks, Christine. Before I open it up for questions, Ms. Hung or any of the applicants wish to add anything in addition to that, those comments?
No, good evening, Mr. Chair, members of the board. For the record, Christine Hung, attorney at Reamer and Bronstein, and attorney for the applicant, Azure Clean Room on Demand, Burlington LLC. No, we don't have. Thank you very much, Christine, for that recap. I don't have any other anything else to add other than we have received and reviewed the conditions, and we're fine with them. So they're good to us.
Great, thanks. Does anybody have any questions to either the Christines or the applicants that are on the phone with us? All the Christines and Frank. Dr. Weiner.
Mr. Chairman, I just, this is the 3rd time that we are reviewing this. I'd like to ask the proponents, is there anything different today that we are not considered from the last meeting? Is there anything different, Frank or Ms. Hung or any of the people? Are there anything different? Because we've reviewed this inside out, upside down, as my kids would say. And quite honest with you, I'm very satisfied with the comments. I'm very satisfied with all of the professionalism of our proponents, engineers, and lawyers. So, Mr. Chairman, I am in support of this at this time.
Thank you, Dr. Weiner. Mary Beth, Libby, Wayne? Anything? All right, great. I think, Dr. Weiner, from myself, I sat on the subcommittee with you. We went through this 2 weeks ago. I'm very comfortable and frankly quite excited about Azure coming into the community. This is the type of businesses that we want. I think we got a great presentation. The entire board did last week. So I feel like we're good there. The only thing that was outstanding was the stormwater management and the changes, minor engineering changes. And it sounds like Christine Mathis that you're comfortable with them. And I just want to reiterate, and Frank, I think you said this 2 weeks ago, we're decreasing the impervious surfaces, and we're actually installing a better stormwater management system than what's there today, 'cause I don't believe there is one there today. Is that true?
That's correct. There's a minimal existing. We're improving that. And then the one item that's sort of a new thing that came from the Conservation Commission. So if you look along the westerly side of the site, that's the side nearest the wetland. We'll be installing sloped granite curbing, which is a more durable edging. It is sloped granite so that the amphibians, turtles, and other things can crawl over it versus vertical granite. And that is something that the Conservation Commission wants. I hesitate to speak for the commission, but I believe they're drafting a decision for this Thursday. So I think we're all set with those folks.
Great. Thank you.
And yes, Mr. Chairman, I am okay with the MEC.
Great, thank you. And it sounds like, Christine Hung, you're okay, and I guess the applicant's okay with the conditions that we provided.
Mhm.
All right, great.
Yes.
So if there are no other questions from any board member, I will certainly accept a motion.
Mr. Chairman, I have one question. Will we be approving the special permit and the minor engineering change separately, or can we do them in one vote? Susan?
I guess I'd defer to Don on that, but I think you can do them in one vote if Don is in agreement.
Well, quite honestly, I unless they're tied together, I would like to do them separately, if that's okay. Yeah.
I understand the special permits and that everything has sort of been merged together.
Right.
The minor engineering change, could you specifically document that? What is that exactly? Because I've been reading them as a single piece.
So the minor engineering change, I believe, and Christine Mathis, you can certainly jump in here, is strictly around the stormwater management replacement or addition in the runoff.
So minor engineering changes are changes to a site plan that are of a minor nature and do not require a full new site plan review by the planning board and associated other boards. So things like utilities, minor changes to the exterior of buildings, pouring of concrete pads, parking lot alterations, that type of thing. And under the category of utilities, stormwater is a subset of those. And it would also include things like a new gas line going in, new sewer line going in, something like that. So that's what we're approving here. And in this case, it is the majority of that quote minor engineering change is stormwater updates with slight exterior building changes.
So, Mr. Chairman, since it's all merged together, I'm just going to provide, I move that we approve the application of a special permit and minor engineering change for 60 Blanchard Road.
Second.
So I have a motion by Dr. Ed and a second by Mary Beth, I think I heard. So all those in favor, Dr. Weiner,
Yes.
Dr. Saltzman,
Aye.
Mary Beth Welch,
Aye.
Libby Wallen-Jevitz,
Aye.
and I am an aye, so that's 5-0. So Christine, Frank, thank you very much for your patience as we go through this process. We're excited again to have you come into town and really appreciate you working with us and getting us comfortable with this new business model. So very excited.
Thank you so much for all the time that you guys have spent on this matter. We appreciate it very much. And thank you also for everything that you're doing for our community and keeping everyone safe. So thank you and good night.
Thank you.
You folks, take care.
Okay, staff reports. Christine Mathis, you're back up.
Hi, I'll highlight a couple of things for you guys. I spent a lot of time on COVID complaints and follow up on interviewing employers and logging COVID positive employees. That was about 11 or 12 different businesses reporting one or two, sometimes three positive employees. What happens in those cases is, there's sometimes a lag before we get a case in Maven, and through the rumor mill at a particular employer, an employee or somebody else will call up and say, I heard of a positive case at XYZ. Did you know about it? And we don't have the case because either it's not a Burlington case and it wouldn't come to us, or B, we just don't have it yet. So we then have to interview the employer, find out close contact information for any positive employees, and track that down. So I've spent time in doing those employer interviews so that other staff can be doing the positive case follow-up and the contact tracing. So the other part of my time, a lot of it has been spent on COVID complaints and investigations. And these, we've been talking about these for months. And these are from general public or employees or all sorts of people call in. And a lot of times it's about mask wearing, social distancing, and that requires quite a bit of follow-up, talking to management. What we run into quite frequently here is larger corporations are handling positive employees and contact tracing on their own. And then, again, that could result in us getting a call that there was a positive employee, but we don't know about it yet because it's gone to corporate in Cincinnati and they haven't called it in to us yet. And we don't have it in Maven yet. And then we get a complaint about it. And so that can overlap sometimes with the positive employee complaints regarding positive employees and other complaints in terms of masking, social distancing, why didn't you get told that there was a positive case, et cetera. So you can see the investigations that I had worked on there. And then the other thing is I staffed a couple of the vaccine clinics. We did 5 over the past 2 weeks, and I think I worked at 2 of them. And that was an enjoyable experience, assisting the vaccinators with their data entry as they gave the vaccination injections to the clients coming in. So I can take any questions.
Great, thanks, Christine. Does anybody have any questions?
Hi, Mr. Chair.
Yes,
Mary
Mary
Beth. Hi, Christine. I said a couple of, the first one is the Philip Rosenfield on your report. Chlorinated solvents were found in groundwater at 18 Terry.
Mhm.
Could you just explain what next steps would be?
So they're doing an investigation there. I got a call because that's the property owner, and he was notified by DEP that he had responsibility. They did site investigation. I believe it was in anticipation of property sale, and they found chlorinated VOCs in the groundwater, which was a surprise to them because there's no history of use there. And he called me to inquire as to whether or not I knew of any local issues. And so it just so happens that we all know of the situation at 179 Cambridge Street, which is the former Mercury dry cleaners, and they are a source of chlorinated VOCs in the area, which did spread underneath the adjacent 181 Cambridge Street, which is now Convenient MD, and behind it to 17 Terry Ave, which is the self-storage facility. So I had let him know that, and he had contacted his LSP, who I believe is currently looking into the potential for downgrading of property status. And the latest information I saw from LSP is they're also doing a design review to look at how they can retrofit their building to ensure the safety of the occupants inside.
Thank you. And
Mhm.
just one more. The Weston Solutions, it said it was a request for a Rooks, am I saying this right? A Rooks report for Middlesex Turnpike Wells. Can you just explain a Rooks report?
So the RU reports are, that's a different environmental consulting group, and they routinely, I think it's twice a year now, maybe 3 times a year, they go out and they sample a number of baseline wells that stretch from the Burlington Mall up to basically where Lifetime is, and on both sides of Middlesex Turnpike. And those reports are done for the town, for the DPW, and it looks at contamination in the area of the Vinebrook well field. And those are public information, so it's just a routine request that we get from this other engineering firm to get a copy of those. Susan, is there anything else to add to that in terms of Weston reviewing those? Well, actually, Weston's also been reviewing them because Weston is also working for the town on the new building at 10 Great Meadow Road and the future new building at 1 Great Meadow Road, which will be DPW facilities. Susan, is there anything else historically that should be added there?
Yeah, Weston is also the LSP of record for the Maycom site. So,
Oh, right,
and I
right.
think, yeah, and I think, so they're looking at the reports because they don't have permission to enter some of the properties that the town does when we do our regular sampling. So that's why they're interested in the data that we collect. So they ask for those reports on a regular basis just so that they can take a look at the data in relation to their current sites that they're working on.
Yeah, so just to add on to that, if you recall, the Maycom site is basically, it originated where Keurig is now and flows down the hill towards Middlesex Turnpike and mall property. So that's why they continue to share those reports, as Susan just stated.
Okay. Thank you. Thanks, Christine.
Sure.
Any other questions for Christine? Christine, I actually just have one. Is the investigation on 12 Harris Drive? What's that all about?
So that was a inquiry from a neighbor because they saw activity at the neighboring site, a private residence, and they were just wanting to make sure that they wouldn't get any water onto their yard. In fact, the person at 12 Harris was being proactive and installing a more robust stormwater management system than the builder had actually put in, which was a dry well collection for a larger portion of the site than what the builder had installed. So it was an improvement, and the neighbor was happy with what was installed.
Great. Okay, thank you.
Yep.
If there are no other further questions for Christine, I'll take a motion to accept the environmental engineer staff report.
So moved.
Libby, do I have a second?
Second.
Mary Beth. All those in favor, Dr. Ed Weiner. You're on mute, Ed.
Aye.
Dr. Saltzman.
Aye.
Mary Beth Welsh.
Aye.
Libby Wallenjevitz.
Aye.
And I vote aye. We got 5-0. Thank you, Christine. And Susan, Director of Public Health Report.
Yes, thank you. So I think I gave a lot of my report when I gave the vaccine update. That's a lot of what we've been working on lately. We're continuing to do the case management for the cases. One thing I will say about that, I noticed in the last week, knock on wood, that they have gone down. So I think that we've seen them go down a little bit in the entire state. So we're kind of seeing in that in Burlington as well. You know, when we were getting over 23, 24 cases per day, now we're seeing around 12, 13 cases per day. So that's good news. Then that's going down. Hopefully it will stay like that. And then we're continuing to work with the schools. We've had a few cases in the schools, and in the past few weeks. I know this week we had we had a couple yesterday, and then we had maybe two last week. So that is taking a lot of and investigation on our part when we have a case in the schools. I did create a form type of letter that goes out to the parents of the children who are on quarantine, so, with dates in it, so that they can understand, okay, this is the day my child was exposed. These are my options. I'm going to do the 10-day option, or I'm going to get tested on day 5 and I can come out on this day. So I did create that type of letter to kind of make it easier for parents. We did have a couple of glitches with that this week, in that a lot of them didn't understand what they were supposed to do with the negative test results. So I changed it and improved it, I hope, so that they can better understand what to do if they want to get their child tested and their child has a negative test result, how they can get them back into school. So we have a list that goes to the schools every day, which I create, updated on who is coming off and going on quarantine. So so that we can all make sure that we're all on the same page with the schools and at the Board of Health. So we do get a lot of calls from parents about, when their child can go back to school. I want to thank all the residents who reach out to us on their own instead of waiting for us to call them. So, and because when people are proactive, if they have a positive case in their house, feel free to call us. And then we'll walk them through it. We do the intake right there. And then when we get the lab results in, the case is already done, and we get to people quicker, get people in quarantine quicker that need to be in quarantine. So a lot of people are doing that now, which helps us out a lot, and also helps us to stay on top of things rather than waiting for test results to come back, which can, in some cases, take a while.
Right, that's great. Is anybody, so I know we have staff reports for, and we can go through those afterwards, the supervising nurse, the health agent, and the associate health inspector, I think the title is. Does anybody have, first of all, any questions on Susan's specific staff report?
Mr. Chairman, I have just a couple of comments.
Go
First,
ahead.
I just want to point out that Susan and the supervisory nurse, health agent, associate health inspector, and environmental engineer worked on the 5 COVID clinics where they gave 200 doses last 2 weeks, and I want to thank them. I also did some counting. Since Christmas, Susan has had to be on 25 major meetings. It's been exactly 1 month. And just to point out how busy she is, on top of everything else, I just need to point out that 25 meetings, whether they be state teleconferences or staff meetings or meetings with many people throughout this region and the community, and that doesn't include complaints or a training or whatever, but that's a lot of meetings, let alone she has to put up with my phone calls twice a day. So anyway, I just want to point that out. Thank you.
I thought I was the only lucky one, Dr. Weiner, but thank you. Duly noted. Any other questions on the director's report? Any questions on the supervising nurse report? Any questions on the health agent or associate health inspector's report? Any questions at all? All right, great. If not, I will take a motion to approve the Director of Public Health staff report.
So moved.
Second.
Second,
think-
third,
I think I heard Mary Beth made the motion, Dr. Saltzman second. All in favor, Dr. Weiner,
Aye.
Dr. Saltzman,
Aye.
Mary Beth Welsh,
Aye.
Libby Wallen-Jevitz,
aye.
and I vote aye. That's 5-0. Do I have to go through each report and approve those as well? Or is it kind of included all under the Director of Public Health?
Well, that's the way they were submitted.
Is that how we normally do it when somebody's not here? We do, okay. So I'll take a motion to approve the supervising nurse report.
So moved.
Libby, second by Dr. Saltzman. All those in favor, Dr. Weiner,
Aye.
Dr. Saltzman,
Aye.
Mary Beth Welsh,
Aye.
Libby Wallen-Jevitz,
Aye.
and I vote aye, 5-0. Motion to approve the health agent's report.
So moved.
Dr.
Second.
Weiner, second by Mary Beth. All those in favor, Dr. Weiner,
Aye.
Dr. Saltzman,
Aye.
Mary Beth Welsh,
Aye.
and Libby Wallen-Jevitz.
Aye.
And I vote aye. That's 5-0. And finally, a motion to approve the associate health inspector's report.
So moved.
Second.
Motion by Libby, second by Dr. Saltzman. Any discussion? All those in favor? Dr. Weiner,
Aye.
Dr. Saltzman,
Aye.
Mary Beth Welsh,
Aye.
Libby Wallen-Jevitz.
Aye.
And I vote aye. That's 5-0. And I guess that brings us to the end of the meeting. Does anybody have anything they wish to bring up or discuss?
Motion to adjourn.
I have a second. Awesome,
Second.
great. So I have a motion by Dr. Saltzman, second by Dr. Weiner. All those in any discussion? All those in favor, Dr. Weiner,
Aye.
Dr. Saltzman,
Aye.
Mary Beth Welsh,
Aye.
and Libby Wallen-Jevitz.
Aye.
And I vote aye as well. That's 5-0. Thank you, everybody. Thank you to all those that are watching for the support of the new position. Appreciate the support out there. And everybody stay safe.
Good night.
All right, everybody, good night. Okay, take care. Bye-bye.